not move this man. He may have a spinal injury. Careless movement of broken or dislocated bones of the spine may crush the spinal cord and cause paralysis or even death. Tell him not to move. Examine him carefully. If there's a head injury, always suspect a neck injury. Feel along the spine for tenderness, pain, or deformity. Check for loss of muscle function. Check for numbness or loss of feeling in the limbs. If any of these signs are present, assume a spinal injury. Unless the victim is in danger where he lies, do not move him. Provide warmth, comfort, and protective care until help arrives. Do not try to change the position of his body. On the rare occasion when it is essential to move a casualty with a spinal injury, it must be done very carefully. A minimum of 4 bearers is needed, even for a light casualty. First, prepare a firm, flat stretcher. A wide board or door will do nicely. Pad the stretcher to fill in the natural hollows at the neck and back. You will need support for the head also. Place the stretcher close beside the victim. Squat at the head of the victim. Place one hand at the back of the victim's head and the other under the chin. Pull firmly, keeping the head tilted slightly back. A second person exerts counter traction at the feet. While traction is maintained, the other 2 bearers place their forearms gently under the victim's body and thighs. Do not bend or twist the neck and back. Lift together and transfer the victim to the stretcher. Support the head to keep it from turning. If a victim is to be moved more than a short distance, immobilize and support the lower limbs. Slide bandages under the natural hollows of the body. Maintain traction while you are working. Pad between the legs. Tie a figure of 8 around the feet and ankles. A belt will do. Tie broad bandages at the knees and thighs. When the lower limbs have been immobilized, use the same procedure to transfer the victim to a firm, flat stretcher. Now your instructor will have you practice. The effects of burns or scalds are similar. Usually the size rather than the depth of the injury determines its seriousness. When a burn or scald is confined to part of one limb, such as a hand or foot, immediate immersion in very cold water will relieve pain and reduce swelling and blistering. Remove rings or bracelets before the part starts to swell. the burned part, such as the shoulder or chest, is hard to immerse, keep cold packs on it, changing them frequently. Add ice to the water to keep it cold. If skin or tissue is burned away, or the condition is complicated by other injuries, do not delay medical care to administer the cold water treatment. When pain has been relieved and some of the redness has disappeared, cover the burned area with a dry, clean, preferably sterile dressing. All serious burns require early medical attention. With infants, even small burns should be considered serious. When treating burns, do not open blisters. Do not apply butter or any greasy ointment. The larger the area burned, the more serious the effect will be on the casualty. The possibility of infection is a problem with all burns, but it is the greatest threat when the skin is burned away and underlying tissues are exposed and partially destroyed. Do not remove burnt clothing which is stuck to the burn. The heat will have sterilized it, and you may tear away skin and flesh if you remove it. Cover the burned area with the cleanest available cloth. Something which has been recently washed and ironed will be reasonably sterile. Shock is a common cause of death in seriously burned patients. Always treat for shock and get medical help quickly. Transport as a stretcher case. Strong corrosive chemicals can quickly cause deep and serious burns. Accidents with chemicals frequently happen around the home, but are more common in industry or at school. Remove contaminated outer clothing immediately. Dilute the chemical and flush it away at once with water. Use a shower, a hose, or a bucket of water. Continue to flood the area while removing clothing, including shoes and socks. When the corrosive has been flushed away, cover burns and get medical aid. Now your instructor will have you work through a lesson on burns. Pieces of grit, loose eyelashes, or small insects often lodge under the eyelids. Sometimes the victim can remove objects from under the upper lid without help. Grasp the upper eyelid and pull it outwards and down over the lower lid. Tears caused by the irritation will help to flush the object out. When a victim needs help to remove something from the eye, remember, the eye is very sensitive, and any examination of it must be done carefully, with clean hands. Tell the victim not to rub his eyes. Seat him facing a good light. Prop his eyelids apart. If you see the object and it does not look to be embedded in the eyeball, try to remove it. Use the corner of a clean cloth. Do not use a matchstick or anything sharp. If the object is not easily removed, do not keep on trying. You could injure the eyeball. The victim should see a doctor. Some jobs have built-in hazards which cannot be eliminated. Wear protective equipment. if your job makes it necessary. Objects embedded in the eye must be removed by a doctor. The first aider can protect the eye from further injury by covering it with a clean, soft dressing. Although only one eye is injured, cover both. If the good eye is not covered, its wandering movement will cause the injured eye to move, resulting in further injury. Help the casualty to reach medical care quickly. Remember, he cannot see. When an object protrudes from the eye or the soft tissue around it, do not remove it. Keep the casualty lying down. Place a dressing around the object. Put something around or over it. A cone or paper cup will do. Secure it firmly in place. Remember to cover the good eye also. Bandage carefully over both eyes. Move the casualty as a stretcher case. Put something at each side of his head to keep it from moving. Eye injuries caused by chemicals can be serious even if treated promptly. Immediate first aid and early medical care is required to avoid permanent injury. The universal treatment is immediate and continuous flooding of the eye with water. A proper eye bath is best, but a drinking fountain or a slowly running tap will do. If these are not available, the victim can sit or lie down while the eyes are flushed. Tilt the head to the injured side to avoid washing the chemical into the uninjured eye. Pour water from the inner corner of the eye outwards. You may have to hold the eye open. You can use a bulb syringe. Remember, the eye is delicate, so flush gently without too much pressure. After thorough flooding for at least 10 minutes, apply a light dressing over the eye and remove the victim to medical aid. Now your instructor will have you work through a lesson on other types of injuries. Any movement of a seriously injured person must serve a specific purpose. To remove him from immediate danger. To make it possible to give essential first aid. Or to remove him to shelter or medical care. If there is immediate danger, you may have to drag a casualty to safety. Pull him the long way, not sideways. Rest his head on your knees. Grasp him under the armpits. Support his head on your forearm. Drag him lengthwise. Casualties with minor injuries which do not demand that they be stretcher cases may be moved by a variety of 1- and 2-man lifts and carries. If there are no injuries to the upper limbs and the casualty could walk if helped, use the human crutch. Stand at the victim's injured side. Put your arm around his waist. Place his arm around your neck and hold his free hand. Note that the two inside legs move together. A casualty with a minor injury who is able to hold on may be carried in the pick-a-back fashion. The fireman's lift can be used if the casualty is not too heavy. Flex the victim's knees and place your feet against his. Grasp his wrists and pull him upward and forward. Transfer his weight to your shoulders. This should be done in one movement. The two-hand seat can be used to transport a victim who is unable to assist with her arms. This is done by two bearers crossing their arms behind the victim's back and grasping the clothing at about belt level. Their other hands are clasped under the middle of the thighs. They rise together. To make a tight hold under the thighs, grasp over a bandage or a handkerchief. The four-hand seat is used when the patient can assist with one or both arms. To do this, grasp your own and your partner's wrist with alternate hands. Tell the patient to place her arms around your necks and raise her slightly. Place your hands under the patient and lift together. When a casualty must be moved in halls or stairways, you can use a chair. Load the patient carefully, supporting the head and neck. Tilt the chair slightly backwards and support or secure the victim in it. You can carry fore and aft. This method is best in narrow stairs or passageways. In wider spaces, you can carry by the sides. All seriously injured casualties and some with minor injuries must be moved as stretcher cases. Many excellent stretchers are available, but they are not always at hand when you need one. In an emergency, you can improvise. Turn the sleeves of two coats or jackets inside out. Pass poles through the sleeves and button the coats. Lash short sticks across the ends to separate the poles. Sacks with holes in the corners can be used instead of coats. A blanket and two poles can be used. Place a pole on a blanket about a third of the way from one end. Fold the blanket over the pole. Place the other pole about 6 inches from the edge of the fold and lap it over. Fold the blanket over the two poles. Always test an improvised stretcher before you use it. A blanket or rug may be used to move a casualty a short distance. Roll the blanket lengthwise for half its width and place it against the casualty. Turn him on his side, maintaining firm control of the head and feet. Move the rolled part of the blanket close to his back. Turn him gently over the roll. Pull the blanket through and lie him on his back. Roll the edges of the blanket tight against the sides of the casualty. Lift carefully by gripping the rolled edges of the blanket. An alternate method starts the blanket at the head. Fold the blanket in accordion pleats. Anchor it by kneeling on it. Support the head and shoulders and pull the blanket under the victim. Roll the edges to lift. When you must move a casualty, first consider his injuries. Use an appropriate method that will not cause further injury. Watch his general condition, especially his breathing if he is unconscious. Do not disturb dressings and bandages. Bleeding must remain controlled and fractures immobilized. Remember, casualties with spinal injuries need special care. The stretcher must be firm, flat, and properly padded. Now your instructor will have you practice. Poisoning is a leading cause of accidental death. When you see these labels, handle with care. What is poison? Anything carrying this label is a poison. Many drugs and medicines are poisonous if taken in excessive amounts. Many natural and industrial gases are poisonous. They are a special hazard in underground work, such as mining and in metalworking, petroleum and allied industries. Recently, in 1 year, exhaust fumes from automobiles accounted for almost 20% of all poisoning deaths in Canada. Many farm and household products are poisonous if swallowed, and some are poisonous if spilled on the skin. Some plants are poisonous if eaten. Poisons may be swallowed, inhaled into the lungs, injected under the skin, or absorbed through the skin. Poisonings in children are usually accidental. Carelessness on the part of adults in the storage of drugs, medicines, and household products are the main factors. In adults, many poisonings are suicidal, but a high percentage occur from improper or careless use of drugs, medicine, and alcohol, and carelessness where poisonous gas or vapors are a hazard. Deal with life-threatening conditions first. Victims of poisoning often vomit. This is a special hazard in the unconscious or convulsing patient. Keep the air passage clear. Get medical advice and help quickly. If the poison has been swallowed and the victim is conscious and not in convulsions, give a glass of milk or water. This will dilute the poison and delay its effects. Get expert advice from your poison control center, hospital, or doctor. Tell them what you know and do what you are told to do. Some swallowed poisons can be removed by encouraging the conscious victim to vomit. But you must be careful not to cause additional damage to the throat and lungs when the poison is brought up. Do not encourage vomiting in the following cases. When the victim has swallowed a strong corrosive or caustic, such as a drain cleaner. When a petroleum-based product, such as kerosene, turpentine, or paint thinner, has been swallowed. When the poison taken is not known and could be corrosive or petroleum-based. When the victim is unconscious or convulsing. Care in the storage and use of potentially poisonous materials will prevent accidental poisonings. At work, abide by the safety rules in areas where poisonous gases tend to accumulate. Now your instructor will have you work through a lesson which contains more information on poisoning.